Hey everybody, how's it going? This is Dr. Schilling from Secoya Health bringing you this week's Wednesday Wellness Minutes, and today we're going to talk about magnetic therapy. You probably saw by the caption on the listing of the video, it's the #1 secret to reducing your healing time by 80%. That sounds like a ridiculous claim, but quite frankly it's absolutely true. PEMF, or cellular exercise as we describe it, or described by the experts in PEMF, is really what it sounds like. Your cells are actually exercising when you're doing it. So each cell expands and contracts. It contracts to throw toxins out and expands to pull nutrients and oxygen in and fluid and things like that. And what you want to appreciate about it is PEMF, this energy that you see in this machine here, does one thing that does the same thing every time, and that's all about exercising your cells and putting energy in. Some people at first think it's like a TENS unit or a muscle stimulation where they might put a pad on two sides of the muscle and then contract it to make it fatigue, so it calm down that and make it less painful. What you want to appreciate about this is even though when you're doing it your muscles are twitching, you're actually going to be increasing the energy and making the cells stronger rather than weakening them and fatiguing them. Okay? So what you want to appreciate is, I'll bring it closer so you can see. This is an example or diagram of how the cell works and how it holds on to energy, and this is helpful to understand from a conceptual standpoint because each cell in your body, all 75 to 100 trillion, are little batteries, and these little batteries need charge. Well, in the old days, and before the industrialized revolution and all the smog and problems we have with our environment now, the Earth used to be a really, really strong magnet. So everybody knows the Earth has a north and south pole. There's a magnetic field. That's caused by lightning. Lightning strikes millions of times a day. Okay? And if lightning were ever to stop happening, we would cease to exist because we need that electromagnetic charge to create what's called electrical potential across our cells. We don't need to get fancy into this, but what we understand is that there's a gradient, like a little electrical charge on each cell, which means we have an electrical charge, and our skin is an electrical organ. And you can measure that with different things. We need that energy to give us life, okay, to allow things to flow through us, like our blood pumping through, our heart's pumping. If it didn't have a charge on the cells, our blood cells, our red blood cells, like in our arteries and veins, would clump together, called rouleau, and then we get strokes or thromboses or things like that. So we need this charge in order to be healthy. All right. We have a poster back here that talks about the 4 main things that are important for getting health. Okay? Proper hydration, proper nutrition, proper sleep, exercise, and PEMF. Okay? Those are critical as far as that goes. Now people are understanding the idea of earthing, right? You have earthing mats. Dr. Mercola made these pretty popular among the natural community, where you stick a stake in the ground, fish it through your window, and then put a pad underneath you or underneath your feet, so you're grounding the whole time. What you want to appreciate though is you have to be very careful about the ground you're putting this probe into, because you don't know what you're pulling up. Let's just happen to say you're putting in the ground near a smart meter in your house. A smart meter is going to have a really strong EMF, so that's going to adversely affect you on that grounding. We're not going to get into grounding tonight, but it's just a general idea. What's really cool about this is there's not a single condition that would not benefit from PEMF. Again, it sounds like a wild claim, but it's actually legitimate. Because it does one thing and does one thing only. It charges your cells. It heals your cells. When you have healthy cells, you have a healthy body. We use a diagram that describes these two, grapes versus raisins. And if you had to be asked which one was healthy cells, which were happy cells, you would most likely point to the side of the grapes. It's going to make you feel better by having juicy, plump cells that can throw toxins out and pull oxygen and nutrients in. So for example, people oftentimes have plantar fasciitis, right? The material or the tissue on the bottom of the foot gets stretched because the arch is collapsing and things like that. One thing you could do is you could sit in this chair, for example, with these pads behind you, okay? And we use different configurations for different people. For example, if someone needed to do transcranial electromagnetic stimulation, we might help them with anxiety or depression, which we help a lot of people with. So you would sit in the chair and you would have a paddle on each side of your head for about 10 minutes, and you switch sides because there's a polarity. Okay? I'm not going to turn it on because it'll depolarize the magnet in my microphone and you won't hear me anymore. But you want to understand that. So if we talk about the adrenals, which the adrenals are in the low back here, sitting right about here, it's a walnut-sized gland sitting on top of the kidney. So your kidneys and your adrenals are probably 2 of the most important things you can have in your body. If you didn't have them, you wouldn't live very long. So we drape these behind the table, the chair rather. They would sit there, and then you would sit in the chair, and quite frankly, you relax. Put your feet up, read a magazine, read a book. If you're careful with your phone, you can keep it over here and not have it depolarized. But this is going to energize those kidneys and those adrenals, which is going to give you energy. And getting back to the plantar fasciitis, in Chinese medicine, the spleen meridian runs down the inside of the leg and feeds the arch. So if your kidneys and your adrenals are weak, they're going to manifest in stress in the spleen. Spleen's a major immune organ, handling lymph and contents of the stomach. And that's going to not send enough energy down the inside of your leg to support your arch. So if your arches are falling, if you're having plantar fasciitis, you can guarantee that you have some type of adrenal stress. And if you live in America, anywhere, for that matter, in the world probably, you're going to have stress. And it's more and more every day. It just seems uncontrollable. But that's not important. We have the tools to A, balance the adrenals, B, support the adrenals, and C, help them heal long term by helping the brain through QNRT and things like that to calm things down. So whatever you might be able to drag in out the street, we have a tool for it because we're treating like a whole person, not just different parts of you. So some people are very sensitive to energy, very hypersensitive, if you will, and react very strongly. So they might have a detox reaction from too much cellular exercise. So when people come in initially, we start them off very low and slow. Probably 3 pulses per second. It goes up to 9.9. Very low, about 30% peak output versus 100. So they would lay on the bed. Okay, so we'll just jump on the bed here, and you just lay back. Generally speaking, we keep our arms down, but you would lay on here, nice and relaxed, and depending on how far you're into your therapy, we would use different attachments, right? We might take these guys, and we might put them over your body. We might stack them, put them over your digestive system. If you have a foot, knee, ankle problem, it doesn't matter what your issue is, this can help. Okay? Many women who have had children, and even women in their later stages of life, even if they haven't had children, for whatever reason, seems to be a problem with incontinence. Bladder, bowel, or both, dropped pelvis, prolapsed bladder, these conditions going on. So what we do with that, and this goes for men as well, prostate issues, inflammation, people with hemorrhoids, very common, where the liver is not processing the blood well enough. We've talked about this on a previous Wednesday Wellness Minutes, where the liver can't receive all the blood, so it puts back pressure and causes the hemorrhoidal plexus to expand, and the feces drags the hemorrhoid out of the rectum, and there it is sitting there. What we need to do is heal that up. So we charge the liver, and we'd also then sit on the stool, so you have a pad and paddles, and energize that pelvic floor. So it's going to help with, imagine it as Kegels on steroids, if you want to imagine a different way of looking at it. So it's going to tonify and strengthen that pelvic floor, which is going to eliminate bladder and bowel incontinence. It's going to decrease inflammation in the prostate. It's going to help women feel a different sensation. Oftentimes people, if you men and or women, you come in with an impact injury to the groin, okay? Could have slipped off a seat on a bike as a child and hit the rail, the bar, if you will. But some type of injury there, okay? A lot of women with episiotomies and or tearing during childbirth, it just depends on what your specific condition is, what your specific situation is. But this will help strengthen that area and make it completely different as far as sensation, as far as function, as far as decreasing inflammation and things like that. So that's just another example of what you can do with it. Again, there's no limitation as far as, the only limitation is the practitioner's imagination, okay? So as I said before, we might stack these paddles here and put them over the liver and gallbladder, which is rampant in our area. We like to call that in kinesiology in Minnesota at least the 3M point, because they have dumped a lot of xenoestrogens in the environment, in the chemicals in the water, in the groundwater, and so they're very sensitive to the gallbladder, or the gallbladder is rather sensitive to them. So we'd stack it over there. We might do it over the GI system for people with GI upset, people with heart issues over the heart, people with imbalances, rather balance issues. We would do it on the cerebellum in the back, people with abscessed teeth, sinus infections. As you can see, the list goes on and on. There is literally no limit to what can be of benefit when it comes to this technology. So just keep that in mind. If you want to cut your healing time down, for example, I'll give you a case study. A child comes in with a confirmed diagnosis of Epstein-Barr mononucleosis. Okay, usually takes 3+ weeks of laying on the couch or in bed, not doing much, recuperating the whole time. Using specific homeopathics and immune boosting nutrition and supplements, we can have them on this for 2 hours a day for 5 days in a row, and they'll be back in school the next week. Okay? It's that quick, and it will heal you that fast. I used to have really bad asthma and eczema due to my gut and leaky gut syndrome, and what I did with this was I spent at least 40 hours charging my gut at different frequencies, different pulses per second, and things like that, different intensities. So where I'm in the chair and I'm literally, jumping up and down, okay? And if Amelia is kind enough, I'll be putting her in the chair here in a moment. I know she relishes that idea. But you want to see kind of what it looks like, what it sounds like, what it feels like. Because most people, even if they've heard of it, they're still like, oh, I don't know what that is, and it probably can't help me either. Quite frankly, there is not a single person walking, talking, or breathing on this planet that will not benefit from this. In fact, PEMF technology is very popular among thoroughbred racing horses because they make a lot of money, and they will use this technology to help those horses heal faster and keep them in peak state, peak condition, in order to be able to win the Kentucky Derby and Preakness Streak, whatever it is. I don't know. I'm not a horse racing guy, but pretty phenomenal beasts. If you've ever been around a horse, they're just massive and just awe-inspiring. So just to give you an example, I'm going to have Amelia come around and we'll do a quick introduction here as far as examples. So do you have anything that's bothering you pain-wise?
Mid-back.
Mid-back, okay. So mid-back is an interesting one. We haven't talked about it on Wednesday Wellness Minute yet. And when you think about it, it's mostly encased in the rib cage. So it makes it challenging to get to. Some people might come in and they have trouble breathing, like deep breaths are causing them pain, or they cough, like somebody gets in a coughing spell, all of a sudden they got a rib out, right? A quote-unquote rib out. Where it's really the muscles between the ribs that are the problem. So we do specific therapies in there. And is it more on the back or the front?
Or back.
Or back, good. So the general thing, we might do something simple, where we're actually just going to gently stimulate her mid-back. I'll just walk around here. So we just drape these behind her, and then she can lay back and relax. Okay. Does that feel right about the level where it's at?
Yes.
Okay, so just relax your head back. And for her tonight, on this particular segment, we're going to do, let's see, I'm going to set her for 4 minutes as I'm talking here. I'm going to do 4.0 pulses per second. And then we'll hit start. Okay? And if you can hear it through the microphone, maybe you can't, the fan turns on, and you'll hear it start ticking. Okay? It's not a bomb, it's not going to go off. But that is, every time it clicks, you can hear the different pulse. Okay? Tell me when it's comfortable with.
Yeah.
Okay. You don't want to turn it up too much so it's agitating. You want to make sure that it's as intense as you can tolerate it without it being painful. That's the general rule of thumb. Now, Amelia's done plenty of PEMF cellular exercise up until now, so I'm not concerned about over-exercising her. If she were just to walk in the door and say, I've got mid-back pain, and it was the first time on the unit, I would say we better start off slower. Right now she's at about 66%. But there are different ways you can turn it up to 5.0, which is the max output, and she's not really doing enough to, there's not enough energy on her to really get it moving yet. But if you can see her from the camera, she's starting to move, and that will be agitating, because I just had her up to about 100%. Okay? But it will get you moving because your muscles are contractile tissue. So what they're going to do is they're going to contract, right? They're going to move your body. They're intended to move your bones. So we can turn up to 9.9, which is actually decreases. The algorithm goes 0 to 5.0, and then it starts decreasing as far as intensity because it spreads them over those different pulses. So 9.9 is really good for brain material, teeth, things like that. Anything that's a sensitive tissue. We use it typically from the shoulders up. We usually use the lower ones down. So this we can like see kind of she's moving pretty good. There you go. So it starts moving her arms. She feels like she's getting hit like she's playing football or something. Alright, so we'll get her back down to 66 or so. So you just play with the variation, alright? So she's got about 2 more minutes left on there, so we'll just set it at 4.0. And that's where she goes. She just enjoys that therapy, relaxes. Again, you can read a book. We played with putting iPads out here, but we generally want people to just relax. So that's really the point. We avoided allowing technology to invade our environment as it is in every other part of our world. This pad here is fantastic, as you saw for the drop pelvis, the incontinence, and the prostate. We have people sit on that, but it's also very good. It's not plugged in right now, but we will put it on the body, okay? Or we put it behind the back. This is probably the most powerful attachment we have as far as this unit goes because it's very small and condensed. So it's going to put out a lot of energy. And when we couple that with the rings, which are under there, or the paddles, it can provide quite an intense experience as far as the input to your body. But this just gives you an idea, right? And what you want to think about, it doesn't matter if it's this pad, the chair she's sitting in, or this bed over here, every square inch, every square centimeter for that matter, has a coil running through it. And every time you hear the tick of the machine, it's just an audible feedback to let you know A, it's working, and B, it gives you an audible registry of how fast the pulses per second are coming out. So every time you hear a tick, it's like a wave. It's like being pushed off of energy, of the PEMF energy. And her body's going to absorb that just like a sponge. And as you know with a sponge, if you ever held it underwater, when it's full, it just runs off, right? So your cup runneth over, if you will. So when the body has the energy it can take at that level, anything else just gets exhausted out the side, and it's not absorbed in the body. As you go through this, you'll notice that you're able to take a higher intensity each time, okay? It's going to be able to absorb more energy at a higher frequency, at a higher intensity each time. The goal is to be able to do it as fast and hard as possible without it being painful, because that means your cells are operating at peak state, peak form, and they are able to accelerate at a much faster rate. I describe this technology as the greatest determining factor as far as how fast you're going to heal. We use the BIA, which is the biological impedance analysis, which is part of our intro exam, to determine your cell energy and its reactance to energy, your cells, that for that matter. That tells me how healthy you are and how quickly you're going to respond. So a person with a really low, in BIA land, it's called a phase angle. So the higher the phase angle, the better. The more resilient, the more strong, the more able the person is to heal. If it's a low phase angle, it's going to require more PMF to get them up to the level in order to be able to heal at the level they need to be. So for example, a lot of our patients that deal with Lyme disease, what they call Lyme disease, we call just a bunch of infections that are culminated in a bunch of symptoms. This will speed up their healing. I don't exaggerate when it'll cut it down in fifths, right? It'll take it down from 2 or 3 years to months, okay, as far as getting back to where they feel alive again. And you'll be seeing some of the testimonials coming out on our website just as soon as I edit the video. As far as understanding people's experiences and how they've been able to get through that. And it doesn't have to be so scary. Like Lyme disease, I just went to a funeral with a friend of mine who passed due to complications of ALS. And like with a lot of people that have ALS, they choose to end their life because they are just so sick and tired of suffering. But when you think about it for a second, it doesn't matter if it's ALS, MS, Parkinson's, dementia, always go back to the microbiome, okay? If something's breaking down the lateral part of the nerve, the amyotrophic lateral sclerosis, which is ALS, if something's causing multiple sclerosis, something's in there breaking it down. Something is tricking your immune system into attacking itself. So my job, our job here, is to determine what is tricking your immune system into attacking itself. And basically just go about starting to just squashing the bugs, getting them back in balance and getting you stronger. So if you know of anyone who suffers from MS, ALS, Parkinson's, dementia, keep in mind, we don't treat the disease, we treat the person. And that's when people get healthy. When you treat the disease, the person loses and nobody wins. Just like cancer. If you try to treat cancer at the cell level, you're going to lose every time. All these diseases, doesn't matter if it's cancer, again, ALS, MS, Parkinson's, dementia, Lyme disease, it's all originating at a brain level where there's stress in the brain, unresolved conflicts that are not being resolved, and allowing the body to break down by allowing the microbiome to go out of control. So crazy. So understand that these people don't have to lose hope. They don't have to just resign themselves like, well, I guess it's going to be 3 to 4 years and I'll be toast. It doesn't have to be that way. If they're willing to fight, they're willing to do the work, and they want to get after it, that's what we're here for. Okay? So just keep that in mind and share that with your friends and family. So I certainly hope this has been educational. It's really a misunderstood science. It's a simple science. It's your cells need exercise and need energy for you to heal. Because if your cells can't make energy, if your mitochondria in your cells are not working, then you're not going to work. Simple as that. So that's it for today's Wednesday Wellness Minutes. Leave us comments below. Let us know what area of information you want to know about, what illness or ways to get over certain illnesses, how to feel better, how to sleep better, how to have more energy, whatever it is. Just send us your messages, and that's what we're here for. Our mission is to, as I think Sasha posted recently, is to touch the lives of 1 million people. Well, I just assume touch the lives of 8 billion people, the entire planet, if you will. But we need your help to do that. So by sharing this with your friends and family and letting them know that there is actually a resource out there that doesn't use a drug for symptom paradigm, that doesn't just try to mask things, but actually works to address the root cause using the information your body has as far as healing ability. That's what we do. That's what we specialize in, and that's what we're known for. So don't hesitate. If you're unsure how to speak with your friends and family about it, let us know. We'll give you some verbiage to use to try and ease your way into that conversation. It's always a little bit touchy when someone's going through a chronic illness and they don't want to talk about it, or B, they're scared to talk about it. It's usually fear that's dragging them into the quiet area. They don't want to talk about it. So keep that in mind, and we look forward to your comments, and we look forward to seeing you next Wednesday for the Wednesday Wellness Minutes.
Have a great evening.
All right, guys.